Hi, I'm Dr. Jeff Banas. If you're watching this, I'm assuming you have some type of interest in our weight loss programs. So I'm going to take a few minutes and explain the process of our programs, what we actually do here, and what separates our programs from some of the other programs on the market out there. The first step in losing your weight is a consultation with me. This is a chance for us to sit down one-on-one, discuss your past issues losing weight, what has worked for you in the past, maybe what hasn't worked with you in the past. We'll discuss your current nutrition, what type of foods you're eating, when you're eating. We'll discuss your exercise level. Are you doing any type of exercise right now? We'll discuss your past medical history. Do you have any type of injuries going on? This is a chance for us to meet one-on-one, sit down, see if we could work with you and see if we'll take you on as a client. If we choose to take you on as a client and we believe we can help you, the first step would be send you out for lab studies. What we are looking for in the lab studies are a few different things. We are looking for some of your traditional lipid, your triglyceride levels, your cholesterol levels. We want to get a mark and see where those are. We're also looking at a couple of hormonal marks. There's a couple of hormones that typically decrease with age, and if these things decrease with age, can make it a little bit more hard or a little bit more stubborn to lose weight. This is not a supplement program. It's not simply we find these hormone levels that are low and then we give you some supplements and you magically lose weight. It's a piece of the puzzle, okay? There are some hormones out there that have been shown that reduce with age, and if these are reduced, only if they are reduced, we will then recommend some type of supplements to get those back into the more optimal level. That will then hopefully help you lose the weight that you need to lose. The next step, what we would do after the lab studies, is we had set up the time to go over nutrition. Now what we're going to do with the nutrition is we're going to give you our set of guidelines, what we want you to follow. However, these are just guidelines. I really stress the importance of learning over time. One of the problems I see with a lot of the weight loss programs or diet programs out there is they typically give you pre-packaged meal. All you got to do is use this point system or eat these meals. That's great if you follow that system and just eat those meals, but we live in the real world. What happens when you go out to eat? What happens when you don't have those prepackaged meals available? So our nutrition program is more ongoing, okay? We want to try to teach you how to eat right and teach you how to choose the foods. We want this to be a lifestyle change. It's not a diet, it's a lifestyle change. And the only way we could do that is teach you why we want you to eat these foods at the times we want you to, and what types of foods and you know why to eat that way. So what we do is we give you your nutritional guidelines, and then you either enter your daily food journal online daily, or you bring it into the office depending on how often you're coming in. If you're coming in one time a week to visit with me or less, we hook you up online, because I want to see every day what you're doing with that nutrition. It's that accountability, and that's where we learn. So we give you the nutrition guidelines, but I go online every day, or I'm looking at your nutrition when you come in, and that's where we make the changes. That's where we're going to give you a lot more of the advice on what foods to choose and how to fit your schedule and your taste. It needs to work with you for you. They're individualized towards you. So we're not going to just say eat this food. I'm going to say eat this food, and then I'm going to try to explain why we want you, because we do want this to be a lifelong change, and that's typically the only way you're going to learn to make those changes. We're attempting to find the bad habits that maybe cause you to gain weight in the first place, and then try to instill new habits and reinforce those new habits so they become a total lifestyle change. So after the nutrition, after the lab test, then what we would do is we would set you up on your exercise program. Now the exercise program, some of it can be done in my office, some of it can be done out of the office, it can be done all in the office, or it can be done all outside of the office. We really need to tailorize your exercise program towards you. All the exercise that you perform is monitored by heart rate monitors. Put a heart rate monitor in you wear a strap, it records your heart rate during the entire activity. This is what allows me to do some of the stuff off-site, or it allows you to do a lot of the program out on your own. I will give you specific heart rate zones to work in based on your specific level of activity, your age. There's a few other factors that go into it. So we can customize your exercise program to whatever you need. Like again, you could use some of the exercise in the office and some outside, or you could do all the office inside. Now the nutrition, the lab tests, the exercise program that we're going to put you on is the same with all different levels of our program. The different levels of our program depend on how often we actually meet. We have patients that come in here 4 days a week and do all their exercise and review their nutritional daily in here. Some people come in twice a week and do their exercise in here, and then do some of the exercise on their own with wearing their heart rate monitors. Other people come in just once a week with their exercise, and then we got others that just come in once a week or once every couple weeks just for our weigh-ins or our consultations. We could really set this up to fit any schedule. We need to make this work for you, and that's our best attempt to do that. So the prices on the programs vary depending on how often we actually meet, and we could go over that together once we meet for our consultations. If you have any questions, please spend a lot of time looking at the website. We got a lot of information on there. If you have any questions or concerns at all, give me a call. I'll probably answer the phone personally. Drop me an email. I'd be happy to answer any questions you have. I take my weight loss program very seriously. It's very passionate to me because I've been there. I was 270 pounds. I know what it's like. I know how frustrating it could be. I also know you can have success with it. Okay? It is possible to lose the weight and keep it off. It can be done. I really want to help people lose the weight, get a new lifestyle, and not only a new body, but a new life. So, you have any other questions, just feel happy to give me a call anytime. I'll be happy to try to help you out. If you want to schedule your consultation, drop me an email or just give me a call and we'll set up a time to sit down one-on-one and talk a little bit more and see how we can help you.